Welcome to ecancer and to the February highlights. I'm Gordon McVie and I'm the editor. Absolutely upfront is a paper by Peter Elwood and a number of his colleagues who have been looking at the UK Biobank. That's a collection of 340,000 people in the UK, and after 5 years at least 14,000 of them have developed cancer. And the message coming out from Elwood's very critical assessment of those who followed a healthy lifestyle and those who did not was that the first group do better than the second group. And the impact of careful diet, of not smoking, of moderate alcohol, of exercise, etc. We know all about it, and people have been saying, but where's the data? Well, here's the data. And the data is that you can cut down your risk of getting colorectal cancer by a third and breast cancer by about the same, and prostate cancer too. It really is powerful data, this, and I commend it to all of you. Peter Elwood is also a big aspirin fan, and we, by chance, unusually have an aspirin paper which has not got Peter Elwood as one of the authors. It's the annual roundup of aspirin data from the literature, and it was held in Berlin, and the people who were there, amongst 10 or so authors, were John Byrne, Sir John Byrne of aspirin and Lynch syndrome fame, and Peter Rothwell, who put together all the aspirin data which shows cutting down of cardiovascular disease, and also turned his hand to looking at all the data on aspirin cutting down the risk of certain cancers, top of which is colorectal cancer. So this is a review, and it's got all the up-to-date papers on aspirin, and the general push now, general acceptance that it's about time we got the message out to all doctors wherever they practice, that on a baby aspirin, 75 milligrams or thereabouts, maybe 100 milligrams, in people who are over 60 years old and maybe younger, if they've got a heart disease history in the family or cancer family history, should be given a trial of this low-dose aspirin, and assuming they don't have any gastrointestinal problems, no vomiting, no gastric pains, then encouraged to take this for life. I've been on aspirin for 25 years and no problem. The anxiety about gastric bleeding has now been cornered down to less than 5% of those people taking this dose of aspirin, and it's very easy to find out whether you like aspirin or you don't. You just take it and find out. So that's the two prevention papers which topped the list in this month's ecancer. Then there's a note of the awful problems in some of the Middle East countries with getting mammography accepted, breast screening, and there's an interesting paper from Iran showing a really awful uptake of invitations to breast cancer screening. And not surprisingly, breast cancer patients are presenting with advanced disease in Iran. We have a very important paper from David Montgomery and his colleagues at Pfizer, who have been studying together with the Association of Cancer Physicians, together with the British Oncology Pharmacy Association, the degree of understanding amongst physicians in the UK of an inverted black triangle. And an inverted black triangle indicates adverse reactions to any medicine after it has been authorised by the European Union. It turns out that not so many people are aware of what a black triangle means. And it does seem as a takeaway message that it's high time that physicians understood what the meaning of this inverted black triangle was. This is all about reporting in a vigilant way. The whole topic is called pharmacovigilance. All the possible adverse effects which can come from oncology medicines. I really think it's important that if you don't know about the meaning of this triangle, then read this paper. First author is Rebecca Thorne. Two papers on ovarian cancer. One is showing yet again that the surgeon is the best specialist to eradicate ovarian cancer, even if it has spread. And this is a really nice paper from Valencia in Spain by Lago and colleagues about the results of radical en bloc peritonectomy in advanced ovarian cancer. And just in keeping with the video tone of ecancer, they have a couple of videos embedded into the text, and they're really, really very interesting indeed. Surgeon at least needs to debulk and preferably get rid of all visible cancer cells when approaching a patient with ovarian cancer. And then a little tailpiece on leptomeningeal metastases after a recurrent peritoneal carcinoma. Most unusual to get a Cauda equina syndrome from leptomeninges from an ovarian cancer. For some reason, ovarian cancer cells, even in the peritoneum, do not seem to have any predilection for the brain or for the spine. And this is one case report just showing it can happen. On ecancer's videos, we have two very important meetings. One, ASCO GU, with superb changes in prescribing and attitude to several urological cancers being well debated and clearly enunciated by GU experts. And then the second one is a coverage of a meeting that we organised in Milan, and it's on precision medicine. And it's a two-day meeting with some really absolutely first-class international speakers on where we are today with personalised or precision medicine and where we are going. Then on our educational section within ecancer, we've got a couple of important bits of news. The palliative care modules, which we first of all filmed in sub-Saharan Africa with support from the IAEA, are now available filmed in India and in English. And what we can now boast is that we've got several of the modules with Hindi language titles. So I certainly commend those to you. I mentioned before the Neutropenia modules, which we've mounted on ecancer under the e-learning button. If you haven't had time to look at them, please go back and look at them, because they do present more up-to-date information than several of the big guidelines which you can read about. And Neutropenia, of course, is still with us in a big way. Because we've moved on to antibodies does not mean to say that we no longer use cytotoxic drugs. And we get neutropenia still all over the place, and sometimes it's life-threatening. That's it for February's ecancer. Thanks very much, and I hope to speak to you next month.